It was a very good example showing holistic care. And I remember Karen sending me an email to say, Joyce, I've got this patient. I said, have you done this? Have you done that? And it's really good that care coordinators can have that role in the GP practice. I think our next speaker will be Martin. He is one of our patient representatives who will speak for his experience, his journey for cancer.
The journey. I hate my phrase. No, I'll be fine. I'm a big loud man. Hello. I recognise some faces from my journey. So I'm Martin, and I'm on borrowed time, and I'm very grateful about that. 7 years ago, 6'6", rugby playing, pretty handsome chap. What are you laughing at, Mark? And I was still playing rugby. I was 55, and I'd gone back to nursing. I'd had 20 years out. I was a dual qualified nurse, learning disability, then general nursing, specialised in ITU. Loved it, great career, really enjoyed it. And decided to go back to it after 20 years out. And I bought some Dr. Martens shoes to wear, and I noticed I was sort of walking round the ward, a bit like Igor, thinking these shoes are heavy. You've spent 20 years behind the desk, that's why your shoes are heavy. And then it became clear that I wasn't quite right. So I played music, I've been a musician, and I was trying to play something, my hand wasn't working. I thought, you've had a little stroke, haven't you? You haven't looked after yourself, you've had a little stroke. Went to see my GP, and I can't remember the name of the test, but the one where they scrape your foot and your toes curl. So I worked on a neuro unit. So when the GP scraped my foot and I kneed myself in the face, both of us looked at each other and thought, oh. Within 1 hour of seeing the GP, I'd had a CT scan of all parts, and the neurologist and I looked at this picture of this very large lump in my head. He said to me, what do you think that is? I said, I think that's a very large lump in my head. He said, you're right, that's exactly what that is. And he said, what do you think we should do about it? See, I like this neurologist, he was getting the patient involved. I said, I think we should take that lump out. He said, that's exactly what we're going to do. And he sent me off to the John Radcliffe. I met with my lovely surgeon, and that's when it started to hit me. You know, this was a few days later. I had a few days to think, I've got a big lump in my head. And I'm sitting in the waiting room waiting to see the surgeon. And this lady comes in a wheelchair, shaved head, massive scar on the side of her head. And she's just above vegetative state, I would say. I'm looking at her and I thought, I've dealt with the I can live through the surgery. I've dealt with I could die during the surgery. I haven't thought about that. I haven't thought about that at all. Could I cope? Would I manage? Well, the surgeon helps by saying that my chances were less than 50-50. The neurologist had told me, if you get through the surgery, probably 5 years. Like I said, this was 7 years ago, so I'm on borrowed time. I'm doing great. Need to write some notes. I've got slides as well, but I'm a last-minute replacement as my computer's not working. So 1 in 2 people get cancer. Some of us are more greedy. Since this, I've had prostate cancer. Again, the numbers were off the scale. But to be fair, because of the brain cancer, I sailed through it. I barely noticed anything had happened. Had radiotherapy, got through at the end. What the prostate cancer is. So the effects of the brain cancer and treatments are I'm slightly triplegic. So my left side doesn't work, it's like I've had a stroke. My right hand doesn't work, with no fine motor skills. I've got a slow gut. I have, although it's a lot better now, occasional incontinence, mostly at the front, which is good. Because the first time you pee yourself in public, it's mortifying. And I think I'm very brave coming out in light trousers today. I remember at an MRI scan, of which I've had many. One of the radiologists saying, you're not the first person to pee on the £10 million MRI scanner, Mr. Cooper, but you might be the first to do it standing up. I need to get through this quickly because I know we're overrunning. So I'm going to focus mostly on the brain. So post the surgery, 3 days after, my wife left me by email. So the first thing I would say is that the holistic needs assessment was incredibly important, because it wasn't just me having my cancer, my family had it, my 2 small children, a wife who was patently not coping with that. And to me, I'd survived the cancer, that was all I could have hoped for, and I was very pleased with that. But my wife leaving was devastating, absolutely devastating. So we lived on a boat, and that wasn't suitable for me. Plus I'm disabled, so obviously the council will find me a house like that. So I went to live with a friend, left the family on the boat, that's theirs now. And Macmillan were amazing, absolutely amazing. Sorted out my finances, gave me some suggestions. I ended up going to Reading ARRS houses. So some of you will be familiar with the old houses opposite the old police station, beautiful old cottages. They didn't put me there. They put me over the road on Kennet Island, which sounds really wonderful, doesn't it? Kennet Island. It's the old sewage works. And they've got this wonderful apartment building, and I met somebody a year after the wife had left. We're married now, which is lovely. So I left the ARRS houses, and they immediately said, "Oh, could you be a trustee? You're a boy done good." So I'm a trustee with them now. I'm a trustee with other charities as well, because I needed to find a sense of purpose. That was the biggest thing when I came out of hospital. I couldn't nurse anymore. My balance isn't great. I walk with a staff now. I can walk without it, but steps and slopes will have me over. I had a fall a couple of weeks back. There's an age thing, where when you're younger you fall over. As you get older you have falls. So I started having falls. When I got to the flat, the occupational therapy, I didn't see much of the physio. I'd like to have seen more physio, because I was still coming to my speech came back very quickly, my balance came back quickly. My key goal was to pee standing up, because that's what men do. And I managed that quite quickly, and then decided that because I've got no fine motor skills, I'm better doing peeing sitting down, which isn't what I do now. So Macmillan were brilliant with the finances. OT was brilliant with giving me lots of stuff I didn't think I needed, but proved very helpful. Especially the handrails in the shower and stuff stopped me falling over. Didn't get much from the GP at the time, but whenever I go back, even now it's a different GP, even now, you kind of feel that they're giving you a little bit more special attention because of what's going on. But at the time, I don't think I needed much from the GP, because the community rehab team looked after me so well. I was sent to Sue Ryder as a day patient, and I hope you all know that that's available for cancer, and that was amazing. It wasn't amazing the first time I went in, because I didn't know why I'd gone there, and I've gone to a hospice, and I've just been dealing with my forthcoming death. You know, I've got brain cancer, I'm going to die. And they sent me to a hospice, and you think, what the hell am I doing here? And then you walk in, and there's all these nearly dead people sitting in chairs that you can wipe clean and eat easily, you know, and you think, what the hell am I doing here? And I think I cried. Walked in, cried, what am I doing here? Within 12 weeks, I'd gone from, I've got a brain tumour, I'm going to die, to what am I going to do tomorrow? So that 12 weeks at the hospice as a day patient was amazing. Really turned a paradigm shift. Look at me using big words. Yeah, so the prostate, I wasn't too worried when the prostate cancer came because I was on borrowed time anyway. And I think because I ignored it, I sailed through it. And all is well. And like I say, confidence enough to wear light trousers. So what else can I tell you about? I feel that I can call the CNSs at the Berkshire Cancer Centre any time. So I've got my brain team and I've got the prostate team. If I have any problems at all, I know I can call. So I've got that number. And on first name terms with the brain people, like I said, because the prostate didn't bother me, I didn't think I bothered them really. What am I doing now? I'm trustee with a couple of charities. I'm the governor at the Royal Berks, which I had been before the brain tumour, but gave up because of the brain tumour. I can't go back to nursing, so I've managed to talk Mark and the Cancer Centre into having a therapeutic clown doctor in the Cancer Centre. So that's a project we're just starting. Reading University are helping me get through a PhD doing that. And I'll be there to find all the people that are scared of clowns and entertain them. And that's my story. Happily married. Silver linings of a brain tumour. Silver linings of a brain tumour. Blue badge parking. It's definitely worth having. I'm not here this afternoon, so if you've got any questions, I'll happily answer them. But I'm just really entertaining rather than informative.
Thank you very much, Martin.
I'm going to ask you a question, one other than what happened to your good looks.
Yeah.
Is if you had to pick one thing that was most useful to you, what would it be during all of this?
The hospice. The hospice. And so I mostly work over at Thatcher at the Rosemary Centre with Sue Ryder now. And it's underutilised.
It is. Yeah.
The spaces. And no one at Sue Ryder knows why people aren't being referred. From what I understand, so I'm not involved in the planning of it, I just go in and talk rubbish with the chaps, and we do the quizzes, and we do crafting, it's all very lovely. But my understanding is that the GPs refer. I'm presuming my GP referred me, but it might have been Macmillan. Yeah, or the CNS. But it's underutilised. There's lots of spaces in Thatcher. I'm presuming there's spaces at Duchess of Kent. And for me, it was that turnaround. There's no one going through the same journey. Let's use the word journey. But there's people walking. The phrase I like to use is you're on a parallel path. You're not walking the same path. You're on a parallel path. Yes.
Yeah,
Oh.
if you want to catch us, we would love you to come and talk to our PCN and explain the service. I think this is this primary care, secondary care communication. I'm a cancer lead at PCN, and I'm not completely sure what you were talking about, Sam. I know we use it for end of life patients as well.
Yeah.
But I didn't know in terms of, so this is great.
Well, I got referred. So let me get the right term. Life-limiting illness. So I had a life-limiting illness. I found out recently, my friend Henry, who's a bit of a lad, despite being in his 60s, had been dating a woman who'd been my specialist nurse at Sue Ryder. She said, "Oh, my man Martin went next." I said, "Martin Cooper?" Yeah. He said, "How's he doing?" Because I normally get the ones that die. So that was great to hear. Yeah. So
I'll find it.
yeah, find me and I'll find out for you. Or I'm sure somebody. You'll see another hand.
Yeah, hi. I'm really happy. Your journey was great, and I have to agree with you as well. I think there's a lot of don't know very much about what's available, what Sue Ryder can do. And I've hit some obstacles with certain patients where they should go down that Sue Ryder Macmillan route, but it's that kind of association, hospice,
Yeah.
and they completely shut down. And they're like, no.
Yeah.
And how do you sell it? Is there a sort of I suppose if they had interactions with the patients who've been through it and see actually it's not about death and dying.
Yeah.
There's actually a lot more to it, and it's helping to improve their quality of life, their outlook. I mean, there's so much to it. But how do you get that point across to patients actually who, breaking that sort of image they have of that service?
So as I say, I walked in and I burst into tears. What the hell am I doing here? It's those chairs.
Yeah.
And if I'd had the information about why I was going, in 3 months' time, your brain will be thinking differently about where you're at. But I didn't get that. So if there was a way of doing that, maybe that's a thing to look at. I don't know. Maybe that's a project for me, Mark.
Well, I think there's lots of ways of joining up. We've got the enhanced supportive care service that Emma helps run that will link up with that. But yeah, I think what sort of daycare at the hospice is a really good resource that patients generally get a lot of value out of, and it's not just for people who are in the life care. So yeah, I completely agree with you.
And long term, because that's limited due to funding. But long term, because of the nature of my disabilities now, I got involved with a charity called Rosetta Life, who improve patients' well-being through performance, be that poetry, painting, or performance. And that led me to go into the stroke groups locally. So it's kind of, if somebody had known, well, you've got the symptoms of having had a stroke, go to the stroke club. If you've got dysphasia, then going to Newbury Stroke Club is the place to go to. If you've got, if you need social contacts or whatever, then go to Tilehurst Stroke Club. So knowing those kind of things, again, it's how can you put down all the resources that are available and remember them? I mean, I don't know how you do that. The yellow book, I like the idea of the yellow book having stuff like that. So Rosetta Life has been brilliant, and because of that I made friends that were in stroke groups, so I started going to the stroke groups. And I'm one of the better physically and speech-wise, and certainly the better looking. Okay?
Thank you very much.
No, thank you.
I think it's time for